my name is Crystal Catron, and I'm an assistant professor and simulation coordinator here at EKU School of Nursing. Today I'm going to teach you how to perform CPR on an adult client. So today we're going to start from the beginning of what to do if a patient is collapsed. So first thing you're going to do is you're going to check for scene safety. Make sure that the scene is safe for you and the patient. Next, you're going to check for responsiveness. You're going to tap, hey, are you okay? Are you okay? You need to call for help. Call 911 and get the AED. Next, I'm going to check for breathing and pulse. I'm going to check a carotid pulse at the same time, no more than 10 seconds. There is no pulse, there is no breathing, so I'm going to start CPR, beginning with chest compressions. Hand placement is important. You want to start at the heel of your hand. You want to place that in the center of the chest. Lock your fingers, lock your elbows, make sure your elbows are over your wrist, and begin CPR at compression rate of 100 to 120 per minute with 2 inches depth. So with that, you're going to do 30 compressions with 2 ventilations. Ventilations, if you have a protective barrier device, you can use that. A lot of people have that on their keychain. If not, that's no problem. You can head tilt, chin left, close the nose, seal your mouth around the patient's mouth, and give 2 breaths, each breath over 1 second. So today I will demonstrate with a protective barrier device. So with ventilation, I want to head tilt, chin lift. I'm going to give a breath. Looking for visible chest rise. 2 breaths, resume CPR. You want to resume until the AED arrives. Once the AED arrives, the first thing you're going to do is turn it on. Once you turn it on, you're going to follow the prompts. The AED is made for a lay person with no medical experience whatsoever to operate. So once you turn it on, it's going to tell you exactly what you need to do. You're going to apply the pads to the patient's chest, and there's a picture to show you proper placement. Once you apply the pads, you're going to plug it in and follow the prompts.
Analyzing heart rhythm. Do not touch the patient.
So it's going to analyze the rhythm to determine if that is a shockable rhythm.
Shock advised.
If it is a shockable rhythm, you need to make sure that you clear your patient. Typically, you need to say clear 3 times. All clear, all clear, all clear. Do not touch the patient. Making sure you're not touching the patient, then you would deliver that shock.
Deliver shock now. Press the orange button now. Shock delivered.
Then you're going to resume CPR. 30 compressions at a rate of 100 to 120, 2 inches depth to 2 ventilations. You will resume that until EMS arrives or your patient regains consciousness, they have a pulse, and they have normal breathing. If you are not comfortable or if you can't remember if it's how many compression ratios to breath, you can also perform hands-only CPR. Hands-only CPR saves lives. With that, there's 2 simple steps. You're going to call 911. If you have your phone, pull it out, call 911, and you're going to push hard and fast in the center of the chest at a rate of a familiar song that has a beat of 100 to 120. For example, Stayin' Alive by the Bee Gees. If you can do chest compressions to that beat, that will get you 100 to 120 compressions per minute. You would keep doing that until someone else arrives, or you'll notice once you start doing CPR, after about 2 minutes, you're going to become very fatigued. So if there's someone there that can switch to make sure you're doing high quality chest compressions, that would be the best option. So again, you're going to continue CPR once you start it until EMS arrives or your patient regains consciousness and they have a pulse and normal breathing. Now let's move on to a child. So for child CPR, child is considered 1 year of age to puberty. So the difference with a child, if it was unwitnessed. So say you came up on a scenario, the child was down, you don't know how long the child's been down, you don't have a cell phone on you, you're going to do 2 minutes of CPR, 30 compressions, the same compression rate, 100 to 120. same depth of 2 inches deep, okay? Then you're gonna leave and call 911 and get the AED. So if you saw the child go down, say you're at a basketball game, you saw the child collapse, CPR is exactly the same for a child. 30 compressions, 2 ventilations. Compression rate is 100 to 120 per minute, 2 inches deep. With the exception to get the 2 inches deep, maybe this child is small and you only need to use a one-handed modality. If the child is large, you may have to use 2 hands to get that compression depth of 2 inches.